My name is Marvelous Olusegun, a civic leader and social entrepreneur. I have 4 years experience in the non-profit sector and earned a Bachelor of Science degree in radiography from the University of Lagos, Nigeria. I am the founder and director of operations and content development of the Invasion Group. The Invasion Group is a non-profit organization based in Lagos, Nigeria, which focuses on reducing the mortality rate from NCDs, non-communicable diseases, in Nigeria. Currently, I work with various community-based organizations and government health institutions to advance health education and promote awareness on the importance of healthy living in rural and urban communities in Nigeria. I have also served as the campus director of the Hot Prize Business Competition and the United Nations Millennium Campus Fellowship. Over time, I've enjoyed working on topics of public health and social entrepreneurship, and I have a very strong passion for youth development and volunteerism. As a medical practitioner with a vision to improve health in Nigeria and by extension Africa, I want to be an Obama Foundation scholar because I want to learn how top non-profit organizations tackle non-communicable diseases. I also want to learn how the health sector in the United States and other developed countries tackle these diseases and promote their health sector in the process. The experience gained from this program will expand my knowledge and provide me with the necessary international exposure that is needed to become a champion of health in Africa. According to the World Health Organization, Nigeria has the highest rate of non-communicable disease related deaths in West Africa. We have a population consisting of 20% of the total African population. This leaves a huge health burden facing the Nigerian people and the government. And various factors contribute to these alarming statistics, some of which include poor public health education, poor health facilities, and so many other things. I have a very clear vision to reduce the mortality rate of non-communicable diseases in Nigeria from the current alarming 85% to 0% by 2030. Participating in this program will empower me with the necessary skills needed to identify relevant stakeholders and also build sustainable network that will be beneficial to improving and sustaining the health and general well-being of my community. At my organization, I act as the co-founder and also the director of operations and content development. I use my excellent analytical skills to evaluate health data and make operational decisions that create impact. I am also responsible for identifying and targeting underprivileged areas in the country where the organization can create real people-focused health impact. I have an unrelenting commitment to reduce the mortality rate from non-communicable diseases from 85% to 40% by 2025, and then further reduce that number from 40% to 0% by 2030. I am achieving this commitment by constantly engaging youths across all levels in all tertiary institutions in the country to embark on massive and aggressive health education. We also organize free monthly basic health screenings to individuals in underprivileged and underserved communities in Nigeria. Individuals who would otherwise not have been able to afford free basic health screening will be afforded the opportunity to these free screenings every month. These steps are geared towards creating a paradigm shift in health beliefs while also encouraging habits that promote good health. In the last 2 years, our efforts has reached more than 8,000 people directly through educating them on various health habits, and also with our community actions have also seen more than 2,000 people directly benefit from our free health screening. Next 5 years, our goal is to educate 50,000 people and also carry out free screening for more than 20,000 individuals in Nigeria.